Well, hello, everyone. My name's Corey Perlman, and welcome to another edition of our video series where we've been talking to experts in the medical field about some of the procedures that they do that help us have better and healthier lives. Today, I'm with Dr. Stephen Brown, periodontist out of the great state of Pennsylvania, specifically Philadelphia. Dr. Brown, welcome.
Thanks very much for having me. I'm looking forward to this because it's an exciting topic.
Yeah, so we're talking about gum depigmentation today. And I'm really excited to talk about this because, as I've mentioned to you before, I really see you kind of get excited about it when we get on this topic. But before we go there, I just want a little bit of your background so people know why you're so credible to talk about this topic.
Well, I've been in clinical practice of periodontics for more than 40 years. And I try wherever possible to be able to speak locally and nationally and teach so that I can bring some of these concepts to people who are in their learning process. So I am professor of periodontics at the University of Pennsylvania School of Dental Medicine. I am professor of periodontics at Temple University School of Dental Medicine. And I am also the director of the Dental Implant Center at Albert Einstein Medical Center. Now, these are all part-time positions. I'm in full-time practice, but my passion is teaching. I've had the opportunity and the good luck to have lectured on these topics across the U.S. and around the world. So it's been a lot of fun, and we are able to make dramatic changes in people's lives.
Yeah, well, speaking of which, as I mentioned earlier about this topic, one thing that I've noticed over the couple of years of working with you and your wife, Pelly, is when we get on this topic, the specific topic of gum depigmentation, you light up. Like you get pretty fired up. There's like a passion that I can see come over you when we get on this topic. So I'm curious why that is and what makes you get so excited whenever we get on this subject.
Well, gum depigmentation is a groundbreaking procedure. And what's amazing about it is that in one visit, generally, we can take a person who does not like their smile because of black patches on their gums or dark gums, as it's sometimes called. And within one visit, painlessly, we can literally turn this around and they leave with a smile that's completely different than the one they came in with. Many people have this darkening of their gums, which they don't like. It is very common amongst African Americans. It is also common in the Middle East and also in the Far East. Patients come in on a regular basis and they don't like their smile and they want to know if something can be done about it. And the truth of the matter is that the pigmentation, for instance, in an African American, they have melanin pigmentation in their skin. It often ends up in their gums as well. But when they smile, you see this, and many patients don't like it. And so we use the terms gum bleaching or gum whitening or gum lightening. All of those things basically are the same thing. It's a normal abnormality that people have. And as I said before, we offer an opportunity for them to change this in literally one visit. So that really excites me. I think you've seen some of the videos of patients that we've done who just smile and they hug you and they're so excited about it. And there's no postoperative discomfort. It's a very straightforward procedure, and it boggles my mind that it's not being done in more places.
So is there any cause to this? Is it genetic, or is there anything that's done, to make this worse?
I don't think it gets worse. Sometimes they get a little darker over the years. But as I said before, this is a natural occurring phenomenon due to pigmentation in someone's skin typically. And it ends up being also reflected in the gums. it isn't something that you can do something about. People in the same family may not even have it, but when they have it, oftentimes patients want to do something about it. And, it's not something that can be avoided. I would sort of compare it to a birthmark or an alteration in color of the skin or gums. And it's naturally occurring. And there's a very, very minimally invasive way of getting rid of it, which we can talk about some more.
Yeah, let's talk a little bit about that, and maybe just take me through the process of what happens when a patient decides that they want to come have this done.
Well, very often they come in and they just simply say, I don't like my smile. It's very dark. Oftentimes there's greater amount of pigmentation in the upper jaw than the lower jaw. They may only want to do one jaw. Most of us know that when we smile, you see more of the upper teeth than the lower teeth. So the way this works is really quite amazing. We use a laser. And laser light energy, by its very nature, is attracted to colors. This is the reason why they use lasers to take tattoos off. It recognizes the colors and it literally vaporizes the color that's in the skin and gets rid of it without any cutting, burning, scarring, or anything like that. So if I see a patient and that patient wants to go forward with this, we tell them, it's a natural procedure. It can be done in a very short time. We numb the gums up just so they don't feel anything. And the laser light energy is used to vaporize the dark color without any collateral damage to adjacent tissue. So it is like a laser beam, no pun intended, that's directly at the dark colors. And in an hour and a half, give or take, we can do the entire upper jaw, let's say. And the patient leaves without any discomfort. Yes, there'll be a little bit of tenderness for a few days, but I'm talking Tylenol tenderness or Advil tenderness. We tell them not to use anything that's going to really irritate, like, for instance, citrus fruits or citrus juices have acid in it, and that will give some discomfort. But other than that, most patients report to me they have little or no discomfort post-surgically. We typically see the patient at about 10 days to 2 weeks, and maybe at a month. But before that, it's virtually all healed. Now, having said that, over time, occasionally, there are some small islands of dark color that come back, and they can be done and fixed, in a matter of minutes, actually. So, and we let patients know if that happens, there's no additional charge for that. We expect that it's a possibility. But most of the time, that's not what happens. Most of the time, patients light up because it's this sort of reveal. We have them smile and they see in a mirror what it looks like. And patients often break down in tears because they've been living with this problem for a long time. And they are able suddenly to see something that they prefer, that they're happy with, that they can share with the world. Because you don't get a second chance to make a first impression. And you make your first impression with people you don't know by smiling. And if you smile and you like your smile, you're a happy person in almost every case.
That's right. Yeah. One of Dale Carnegie's 31 human relations principles is simply smile. So it's indeed important. And it's important to have confidence in your smile. And it sounds like it's something that is fairly easy for someone to be able, to fix if they don't have a confidence in that. And the other thing that I liked hearing from you, Dr. Brown, is that if for whatever reason they're not fully satisfied or something comes back, that you'll fix it, and that you want to make sure that they're happy.
Oh, absolutely. Absolutely. And the thing that's so great about it is there's literally no downside to this procedure. I mean, I've never seen an infection or anything like that. And I will tell you that there are other methods for treating this. And some of those methods are fairly invasive. It's like dermabrasion on skin. That's one way they do it. Another way they do it is with scalpels and cutting. I mean, those are heavily invasive procedures that require stitching often and long time, healing process. This is not like that.
Yeah.
This is not like that.
I don't use the term lightly, but it seems like a no-brainer because, I mean, it fixes the problem without invasive treatment and lots of recovery and stitches and all the things that you would not want to have happen in a procedure like that. So,
and almost always we get hugs.
I bet you do.
Almost always, it's fantastic. And almost always, these people go out and tell their friends who have a similar problem about it. We get calls all the time. I came in because Shirley Jones had this done 2 weeks ago, and she looks fantastic.
Yes.
Nothing
the work speaks for itself.
Right. Nothing could make me happier because so many of the things that we do in dentistry are marginally invasive. And doing something like this that's minimally invasive, it puts me in mind of what we do in treating active periodontal disease, where we use a laser and we're not doing the cutting and bone grinding and all of that is typically done by most of my colleagues across the country and the world.
Yeah, it's pretty neat, man. You're changing people's lives one smile at a time. And that's really cool. And I totally get why you and Pelly get so giddy and excited when you're talking about this procedure. I've seen the pictures, I've seen the videos, and I've seen people literally transformed in 90 minutes and have their confidence back. And there's just nothing more amazing and transformative than seeing that.
You've hit the nail on the head. And if anybody wants to see the changes up close and personal, let them go to my website. It's www.theperiogroup.com and just type in gingival whitening, gingival depigmentation, and they'll see lots of patients' pictures.
Yeah, so that's actually the question I was going to ask you. So the website is a great place for people to go for more information. And is there a phone number or email address that you could give us?
Yes. My office number is 215-735-3660, option 2. And quite frankly, I give out my cell phone number. If someone wants to give me a call, I'm more than happy to talk to them. And that's 215-806-8779.
Wow. Well, that's rare. So thank you for doing that. And feel free to, for those of you watching this, to explore and check it out. Dr. Brown has a Facebook page and Instagram as well. You can see some of the patients before and afters there, and feel free to inquire with him and his team to see if this is right for you. Dr. Brown, any final words? I mean, I really think that this was short and sweet, but you really did a great job of sharing what it is and the benefits to it. Any final words from you?
All I can say is you don't have to live with a smile you don't like if it's because of pigmentation in your gums. We can fix it, and we can fix it easily, non-invasively, and we have amazing results. We look forward to seeing you.
Thank you, Dr. Brown. Always a pleasure to talk to you, especially on a topic like this. Thank you so much for your time. Thank you for all the hard work that you do, and thanks for changing people's lives. Everyone, until next time, we appreciate it.
Thank you for having me.
Have a great day. Take care of yourself.
Take care. Bye-bye.
Bye-bye.